Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. Most of us take our feet for granted until they start to hurt. What can we do to keep our feet happy and healthy? This is the People's Pharmacy with Terry and Joe Graydon.
Is there anything you can do about flat feet or bunions? What's the best treatment for a sprained ankle? Do home remedies for nail problems make any sense, or should you stick to the prescription products?
We'll get answers to these and lots of other questions about foot and ankle health from Dr. Georgeanne Botek, podiatrist and medical director of the Diabetic Foot Program at the Cleveland Clinic.
Coming up on the People's Pharmacy, find out how you can treat your feet right.
First, this news.
In the People's Pharmacy health headlines, sleep is crucial for healthy brain function. Too little sleep can make it much harder for people to think clearly the following day. Now, however, scientists say that sleeping too much may signal the onset of dementia. The data were collected as part of the Framingham Heart Study. Almost 2,500 older adults taking part in the study were asked how long they slept every night. During the 10-year follow-up, 234 of them developed signs of dementia. Statistical analysis showed that those who slept more than 9 hours a night were at double the risk of such a diagnosis. This was particularly marked among those who had never finished high school. Long sleepers with less education were at 6 times the risk of dementia than other study volunteers. The researchers believe that long sleep duration is probably a marker rather than a cause of dementia.
Hospital records don't make note of all medical errors and problems with treatments, according to a study published in JAMA Pediatrics. The researchers collected data from 3 sources. They talked to the parents of hospitalized children, they interviewed the healthcare workers taking care of the young patients, and they scrutinized the children's medical records. They discovered that parents, doctors, and nurses agreed, for the most part, on errors and serious reactions affecting the children. But the medical records missed nearly half of the errors families reported and almost a quarter of the adverse events. The hospital incident reports only picked up about 1/5 of the problems families reported and 1/3 of the serious reactions. This suggests that patient safety data on pediatric wards could be greatly improved by including parents' reports in electronic medical records.
When people start sniffling and sneezing because of spring allergies, they usually rely on antihistamines and nasal sprays. A new study suggests they might also want to consider the bacteria in their bellies. A double-blind, placebo-controlled trial of 173 people with seasonal allergies found that those who took a probiotic for 2 months had significantly higher scores on an allergy-specific quality of life scale than those on an identical-seeming placebo. Their allergy symptoms also improved. The probiotic contained 3 billion colony-forming units a day of Lactobacillus gasseri, Bifidobacterium bifidum, and Bifidobacterium longum. This particular probiotic product has been shown in a previous study to stimulate production of interleukin-10, which helps the body tolerate allergens. There was a change in intestinal bacteria towards types that are thought to be more beneficial. How the microbiome affects the immune system is still not well understood.
The rates of colorectal cancers have been declining for decades. That may be in part because of screening through colonoscopies. Most such cancers occur in middle-aged and older people, but an alarming new trend has recently been detected. People born after 1990 are at higher risk for colorectal cancers at a young age. While the absolute risk remains low, the increase is dramatic and worrisome. Because physicians do not normally screen young people for colorectal cancer, it may take longer to diagnose than it would in an older individual.
As the weather warms up and mosquitoes become active, people need to pay close attention to the type of mosquito repellent they choose. A team of researchers at New Mexico State University tested a range of products promoted for preventing mosquito bites. Only DEET, a tried-and-true insect repellent, and oil of lemon eucalyptus were very effective at discouraging Aedes aegypti mosquitoes. This is important because this type of mosquito carries viruses that cause Zika, yellow fever, chikungunya, and dengue. Wearable devices such as bracelets were almost totally ineffective and shouldn't be relied on. Citronella candles, a popular product for people who don't like bug spray, did not work well either. The scientists urge consumers to read the labels on their spray and choose one with lemon eucalyptus oil or DEET. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Our feet take a beating. We rely on them to get us around, but we don't always wear sensible shoes. We might prefer shoes that look cool to shoes that are good for our feet. What price do we pay for vanity?
To help us answer questions about keeping our feet happy and healthy, we turn to Dr. Georgeanne Botek. She's a doctor of podiatric medicine in the Orthopedic and Rheumatologic Institute at the Cleveland Clinic. Dr. Botek is head of podiatry and medical director of the Diabetic Foot Program.
Dr. Georgeanne Botek, welcome to the People's Pharmacy.
Thank you.
Can you tell us what is the difference between podiatry and orthopedics, please?
Sure. The line can be somewhat gray with that, but a doctor of podiatric medicine completes 4 years of a school that is doctor of podiatric medicine, which is often associated or affiliated with other medical schools. After that 4 years, we specialize a little sooner than, say, a foot and ankle orthopedist. So our standardized residency is a 3-year program that follows the 4 years of your doctorate program. Unlike orthopedics that will complete their medical school training and then go on and do a residency that may be more generalized before becoming a foot and ankle orthopedic surgeon, which is a fellowship program after their orthopedic training. So they do full body orthopedics, then they often will do a 6-month or a 12-month fellowship in foot and ankle surgery.
So let's see if I've got this right. A physician who goes to medical school and then specializes as an orthopedist basically is a bone person. In other words, they're dealing with joints, they're dealing with bones. If you break your arm, the chances are an orthopedist, an orthopedic surgeon is going to reset it. If you're going to have a hip replacement, it's going to be an orthopedic surgeon. And sometimes they may specialize in foot and ankle stuff. Podiatry is the field where foot and ankle stuff is your main event. That's where you work. You're not working on ears. You're not working on elbows. You're just dealing with feet. Have I got it right?
Right. In the end, that's how it works. While you're doing your training, you may be doing residency rotations in internal medicine, infectious disease, vascular surgery. But once you're practicing, you're just doing foot and ankle work.
Well, it strikes me that if your feet hurt, you don't feel good, you don't function well. So feet are pretty darned important. What kinds of foot problems do you see most frequently, and what can you do for them?
Well, that's a pretty general question. We see
it is.
From skin to skin deep to the level of tendon and bone. So I would say in my general podiatric practice, I see a lot of heel pain or plantar fasciitis, Achilles tendonitis. We'll see stress fractures, ingrown toenails, warts, bunions, hammertoes, osteoarthritis, rheumatoid arthritis, anything where there's a manifestation of foot pain, basically, that drives someone into the office.
I had foot pain, I'm going to say, about 6 months ago. For some silly reason, I decided to run after my dog wearing my combat boots, or my hiking shoes, and it was very uneven, and the result was when I got home, I knew something had gone wrong. There was no, one moment when I said, ouch, but it just got worse and worse, and over the period of the next 6 to 8 weeks, it did not get better. And I finally went to a doctor of podiatric medicine, and this doctor was very good. And he said, well, I can see where the pain, I can feel the pain. I touch here and you wince. And he said, it's not exactly plantar fasciitis. It's more on the ankle side. And he traced it all out. And he said, look, I could sell you orthotics for about $600, or you could order online some sort of pre-made orthotics for about $60. And he said, I'd start there first and see how that works. Now, I've had orthotics for years. I play tennis, and my orthotics wouldn't dare get on the court without them. But they've always been these specialized ones, and mine had kind of worn out, to be honest with you. Darned if those off-the-shelf orthotics didn't work like a charm. I mean, it was amazing. But it took another 6 to 8 weeks for that to make a difference. So can you help us understand when it's okay, like in my case, to use the off-the-shelf orthotics, and when it's important to spend $600 and get personalized ones?
And I have a stupid question that goes along with this. Could you start by explaining, please, what is an orthotic?
Gladly. So a foot orthotic has other names as well. Foot inserts, accommodative foot orthotics, insoles, and it's a device that you place into your shoe, and it makes contact with your foot. So essentially, it's almost like a plate or a piece of material that would fit underneath your foot, or even replace the liner or insole of your shoe that you're wearing. And over time, I've been practicing about 20 years now, the over-the-counter devices have really evolved. Now, in your situation, you might not have known which device to go and look for online, which device to place your order for, whether it's size or the make. There's so many different kinds, soft insoles, there's more firm, rigid, functional foot orthotics. So there's different materials that make up these devices. And I think it does pay off to have that expert opinion to know, well, what should I purchase, first of all? I have patients who come to see me with years of foot pain, and they come in with a whole bag of different devices that they bought at various pharmacies or online. So we say that probably 80% of people do well with an over-the-counter device, one that you do not need a prescription for, one that runs between $40 and $60 rather than $400 to $600. So it is a good place to start. My father-in-law is a perfect example, too. He has very difficult to fit feet. Fit him with that custom-made insert years ago. Then he was pain-free and asymptomatic 4 years. And then for Christmas one year, I got him some Power Step inserts. And they're over-the-counter devices that are sold in our Cleveland Clinic pharmacies. He said, well, why didn't you just prescribe these first? Why did I ever get custom-made insoles? I love these, So for 80% of the people, an over-the-counter device, if you know which one to pick out or what might fit for your foot and your foot issues, is a good way to go, rather than going that custom-made line. And there's a lot of orthotics companies actually that are going out of business with some of their products because they can actually find something that is very well made and durable that's a lot less costly to them. Well, they may not be making the same profit.
This is public radio, and I have no conflict of interest and no investment in this company whatsoever. Mm-hmm. It's Soles, S-O-L-E-S. And they say you can either put them in the oven and bake them. I don't quite understand that process. Or you can just wear them. Well, I just opted to wear them. And for me, soles are working just fine. I wouldn't go anywhere without them.
Right. Now, there are certain modifications that will make to the foot orthotic or the foot insert. Probably the most common accommodation is a metatarsal pad. And a metatarsal pad fits kind of into the arch and the ball of the foot to unload the plantar aspect of your foot where you might get calluses or you might get nerve-like pain. And now that can be a little bit tricky sometimes to know what size, what shape, or how it fits. There are a few select over-the-counter devices that have them in, or we might need to, modify that foot orthotic, even if it's just an over-the-counter device in the office itself.
Is this the most common treatment for plantar fasciitis?
It is. If you go to blogs, even with people who've been suffering for years with heel pain and plantar fasciitis, they'll say the right insert made all the difference. And just like you, Joe, the maximum benefit isn't immediate often. For some people, it might be immediate relief, but 6 to 8 weeks after you've been wearing the device is when you've really reached your maximum benefit. And a foot orthotic often doesn't cure an acute foot pain. It often can keep your pain maybe at bay or prevent you from getting recurrence of your pain. So there are other things often if you have acute pain or a problem that we might do in conjunction or before we would recommend that orthotic device.
Now, one reason why I've worn orthotics for a good part of my adult life is my flat feet. I mean, I have got such flat feet. It's embarrassing, to be honest with you. So what causes flat feet? How common is this condition? And is there anything else besides orthotics?
And when we're talking about flat feet, what the heck do we mean?
Okay. So imagine putting your foot in a pail of water, then stepping out on a piece of parchment paper. If you have a flat foot, that water impression is going to be along the inside of your arch, from your heel to your big toe. So a flat foot is what we also refer to as a pronated foot, where the arch comes down towards the floor, your heel bone kind of turns inward towards your knee, and it's a condition that often is inherited. So there are really two types of flat feet, one that you'll have from birth, and the second that you'll acquire more as an adult. An adult onset flat foot is probably the more common condition that we would see and treat and often prescribe orthotics for later in life. And it can come on from a number of reasons, from just wear and tear. Every decade of your life, you're more prone to have bunions and hammertoes and toenail fungus and flat feet. And it's from almost like a tethering or a weakening of some of the tendons that run from your leg down into your foot. Other causes of just flat feet are wear and tear, arthritis, injuries, and added weight. As we become a little bit heavier over time, your arch can actually change. Our feet are dynamic structures. They change as we get older or as our bodies change.
You're listening to Dr. Georgeanne Botek. She practices podiatric medicine at the Orthopedic and Rheumatologic Institute of the Cleveland Clinic. She's head of podiatry and medical director of the Diabetic Foot Program.
Terry, I love talking about feet with an expert because it seems like I've had all of these problems myself. I've had plantar fasciitis, I have flat feet, I've got bunions, I got it all, and we need an expert to help me out.
Absolutely. I was fascinated to learn that you don't have to be born with flat feet, that your feet can change.
Yes, over time. Well, after the break, we'll find out how to treat sprained ankles.
Could a sprain turn into a chronic problem?
And when should you consult a podiatrist?
We'll find out what a bunion is and what you can do about it.
And how effective is bunion surgery? Does it hurt? Are there other treatment options?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Redex Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. 800-345-7339 online at uttercream.com.
If you would like to order a CD of this show, you can call 800-732-2334. Today's show is 1070. That number again, 800-732-2334. Online at peoplespharmacy.com.
Today we're talking about foot problems and how we can avoid them or treat them.
Flat feet, bunions, sprained ankles, and ingrown toenails are common. What should you do about them?
Our guest is Dr. Georgeanne Botek. She practices podiatric medicine at the Orthopedic and Rheumatologic Institute of the Cleveland Clinic. She's head of podiatry and medical director of the Diabetic Foot Program.
So I have to tell you, Dr. Botek, when I was a little kid, because I think I inherited flat feet like from day one, even though my mom had really high arches, when I stepped down, if my feet were wet when I got out of the swimming pool, you couldn't see much of an arch at all. I mean, it was just like all water and nothing in the middle. And I would be taken to the orthopedic shoe store. And I don't know what it was back in the 40s and the 50s, but these were the ugliest shoes on the face of the planet. I mean, I was so embarrassed to go to school wearing these special orthopedic shoes because they just had no style at all. I remember one year I said, "Come on, Mom, I really want some penny loafers." And it was like, "No, they're bad for your flat feet." So, what is it about those ugly shoes? I hope we've evolved to something a little bit better, or now we just stick orthotics in them and it doesn't matter.
Well, beauty is in the eye of the beholder, right? So our judgment changes and our idea of what looks good does change over time. But you're right, like a lot of the kids just put on their flip-flops or just slide on into their shoes without socks, and those are probably not the most supportive shoes. Those shoes that have the real soft, flexible soles aren't going to be good for someone with flat feet. We need a good, strong heel counter, a good Vibram rubber sole for support underneath the heel and arch of the foot. So shoes really are your treatment, and I tell that to my patients all the time, where your shoe can be your treatment. As you attest, you didn't necessarily have foot surgery to correct your flat foot, the deformity. Over time, you lived with it. Foot orthotics are one treatment for flat feet. There's non-surgical treatment and then surgical treatment. We need to have a laced-up shoe. We need to have that shoe that's going to support the arch, that you can accommodate and tighten over time to give you support and prevent the arch from flattening more or worsening more. Stretching is another thing that we often combine for treatment of a flat foot, because this is often concomitantly with tight leg muscles, meaning your calf muscles are kind of tight, and it forces more pressure across the medial arch of your foot rather than the outside of your foot. So stretching is part of that treatment as well. Ice can help too. I mean, there's nothing that replaces ice. That's Mother Nature's treatment, and no one makes money on ice, so no one sells it too hard, but it is really effective if you have sore feet or arch pain. Weight loss too. 2.5 times your body weight comes through your heel and arches with impact.
Well, I'll tell you what really messes me up. Flip-flops. If I go to the beach and I'm wearing flip-flops, my feet will suffer.
Right. And I had that same experience too this summer. Overdid it with flip-flops. But there are better flip-flops now. And it's not uncommon to recommend 1 or 2 brands now that have deeper heel seats. It's almost like a built-in orthotic within the flip-flop. Now you're going to pay more. You can't go to necessarily any store and pick these up. But, with the internet and Amazon, it's a wonderful thing. And many people are turning to more orthopedic brand and recommended flip-flops. And you can kind of sneak them in. Not everyone even realizes, what those are. It's not as obvious as your clunky leather, laced-up tie shoes.
Well, let me turn the conversation from flat feet, which are definitely important, to sprained ankles. As I understand it, ankle sprains are extremely common. And when you were talking about ice, that reminded me that that's one of the first things that's usually recommended. If you sprain your ankle, you're told, put ice on it, elevate it. What else do you do?
Well, ice and elevation are certainly helpful because walking on a sprained ankle can be really painful. If you're not able to walk it off or walk like heel to toe on your ankle without having to like really limp, then that's something that does need treatment because you have to rule out anything more serious than a sprain or just like a twisting of your ligaments to your ankle.
So is that what a sprained ankle is, a twisted ligament?
Right. The ligament that runs from your talus to your fibula can be sprained or can just be kind of stretched, and that's what causes that pain. And then there's different degrees of ankle sprains. So if it's an ankle sprain that you can walk on, you can kind of rest assured that it just needs a little rest, ice, and some time to get better. If it's something that's really causing you significant pain and you're limping, then that's something that may require an X-ray to rule out other types of diagnosis. But for the typical ankle sprain, time does heal and rest. So for that basketball player, realizing that they have an ankle sprain, tapings and rest and not necessarily running competitively with time should do it. But physical therapy is key for someone who's a little bit more athletic or needs to be running on that ankle. Physical therapy to strengthen the ankle ligaments is really crucial in that athlete, whether it's a weekend warrior or someone who's exercising competitively.
Now, I'm sure almost everyone has experienced a sprained ankle at some point. I certainly did when I was playing basketball. You know, you'd go up to get a rebound, and then you'd come down on somebody else's foot and turn your ankle, and we called that a sprain. But one time I was taking ice skating lessons, and I did a jump, and I came down badly, put it mildly, and ended up tearing those ligaments. And I swear it took months, maybe as long as 3 to 6 months for that ankle to actually heal. It seemed like it took longer for that injury to get better than if I just broken something. What was going on?
Well, it sounds like you may have torn more than one ligament, and it wasn't just stretched out. There was actually loss of the continuity of the ligament. And there's a whole complex of ligaments that surround your ankle. If you've done damage to more than one group, then you're going to have a harder time healing. And there isn't anything, I mean, it's kind of a myth to think that it takes longer for bone to heal than it does a tendon or a ligament. It can take just as long as or longer, as you can attest. Now, there is the surgical aspect of fixing an ankle too. So if it's a repeated injury or if it's a complete rupture in someone who's young, healthy, athletic, and needs to get to a high demand sport, then, an ankle brace, icing, and time and physical therapy may not be enough to really give you the stability that you need to do what you need to do.
Speaking of braces, we have a dear friend who was pretty much at her wit's end. I mean, she was virtually wheelchair bound because her ankle had deteriorated so badly. And she was scheduled for surgery, and it was going to be a pretty serious surgical procedure because there was so much damage done to that ankle over a very long period of time. And then her husband discovered someone out on the West Coast, I think in the Seattle area, who had a brace. And this woman has gone from a wheelchair and scheduled for surgery to walking around really well. Can you tell us a little bit about braces and where they can actually come into play sometimes?
Mm-hmm. So you can kind of make that same analogy from an over-the-counter foot insert to a custom-made foot orthotic, from an over-the-counter brace to more of a custom fabricated ankle brace. I think I know exactly about the brace that you're referring to. And there's been a whole host of other braces that have come out since that original brace. And it can be life and life-saving in that regard because not everyone wants to have surgery. Not everyone wants to take that time off or take on the risk or maybe can medically undergo surgery even. So the reason why a custom brace might be made is that this is a chronic problem. An over-the-counter maybe helped somewhat, but did not give complete pain relief, or maybe it's an individual who has a hard-to-fit foot or ankle. There's actual deformity there where you're out of alignment, where that brace is just, customized to your foot and ankle. And the whole purpose of a brace is similar to the whole purpose of a surgery, and the whole goal is really a pain-free ambulation, being able to do what you want to do in a pain-free state, not to affect the quality of your life. So that custom brace does the work of surgery in that right person.
Dr. Botek, if someone sprains an ankle, let's say, and doesn't have it properly tended to, can they develop chronic problems?
Absolutely. So just as a broken ankle that's not fixed properly or treated properly can lead to ankle osteoarthritis or just wear and tear of the ankle joint itself, so can an ankle sprain. So if you weren't properly immobilized, properly rested, it can destabilize your ankle. And over time, that instability can lead to chronic inflammation. And that chronic inflammation of the lining around your ankle joint can also lead to ankle arthritis or chronic pain to the ankle. In addition, if you're walking on a sprained ankle that isn't stable, it can lead to other tendon problems. Like there are tendons on the outside of the ankle called the peroneal tendons that are behind your ankle bone on the outside of your leg. Those peroneal tendons over time can overwork just to try to strengthen that ankle and keep you walking heel to toe, and pain along the course of those ankles can also give you grief. So over time, an untreated ankle sprain can lead to arthritis, it can lead to tendinitis, it can lead to chronic inflammation or just swelling around the ankle and affect the way you walk.
So how would a patient know, when to let it heal itself, or when, in my case, it was like, wow, 6 weeks, 8 weeks, I'm still limping, I better go see a podiatrist. How do you know when to make that decision?
I think you know if you're getting better week to week. You have to kind of reassess your situation. Are you better off today than you were a week ago or 2 weeks ago? And is it sustainable? Is this pain less frequent? Is it less intense than it was? And if you find that you're getting better, you probably have something that, if you listen to your foot, you let your foot or ankle be your guide over time, whether that's 4 weeks or 6 weeks, you'll get better. We can't see every single acute pain that happens to the foot and ankle. So you kind of have to judge on your own, whether you're getting better or not. But I think the period of time of 4 to 6 weeks is good. And then you have to also take into account how long is it going to take to get an appointment, right? If you call and you've been suffering for 3 months and it's another 2 or 3 months to get an appointment, that could be, a bigger problem for you too. And more excuses not to exercise or more excuse not to do this or that. So really judging how you are on a week-to-week basis is a good way. And are you overdoing it? Are you hurting yourself by not listening to your body? If you are limping or your pain's on a scale of 1 to 10, a 6 or a 7 as you're doing that activity, then you need to scale back.
I'd like to ask about another common and chronic foot problem, bunions. What are they and what do we do about them?
So a bunion is a deviated great toe. If that big toe or that toenail is starting to push toward your second toe, the adjacent toe, that's called hallux abductovalgus. That's what we refer to as a bunion. Now, a bunion in Latin means turnip. So if you have like a red, swollen area along the knuckle beneath your great toe, technically, I guess you can call it a bunion, but there's different reasons why you might develop deformity of your great toe. Hallux abductovalgus is what we traditionally call a bunion. It's a malalignment where the joint is deviated. It's not sitting straight. If we were to take an x-ray of your foot, it's like a head in the hat. The hat's tilted off of the head. You can't draw a straight line through the big toe joint.
Now, I have to admit that I do have a bunion, and it happened for me after wearing some really bad-fitting tennis shoes. They were very expensive, and I wasn't willing to throw them away the way I should have. And after about 3 to 6 months, boy, I was in trouble. So I went back to good shoes, and it's kind of subsided, but it never completely goes away. What can you do as a doctor of podiatric medicine to help people with my kind of bunion?
Well, education. So not every bunion is a surgical bunion. While the only way we could change your x-ray or change the way your foot looks would be to do an osteotomy perhaps, or surgery to realign your great toe. And the indication to do that is pain. And usually it's going to be pain that persists more than a year and you feel like it's getting worse and it's interfering, with the shoes you wear or maybe with the exercise you're doing because it's just chronically painful and aching, or you come home from work and you just want to put your feet up because another step and you just can't bear it. So good shoes can be the treatment for some people. We see this more commonly in women than men, and I think you hit the nail on the head there. Our shoes, we wear higher heeled shoes, we wear different styles shoes, they're not rounded in the toe box, so women are more symptomatic with their bunions because of the shoes we wear. So doing surgery on your shoes before your feet is always a good idea, but surgical correction is really the only way we can correct the appearance of your foot, but more importantly, like the pain and deformity that you have.
First of all, how painful is the surgery and how effective is it?
It doesn't hurt me a bit not to do it.
Good for you.
But I wouldn't let pain discourage you from undergoing a bunionectomy because it's controllable. We have longer-acting pain-relieving medications now. We have more regional nerve blocks that can be done to postpone pain. So while it can be bad for a day or two, it also is controllable and treatable. And I don't think most people would say, I wouldn't have it done again because of the pain. I think we've gotten better at controlling pain over time, over the last, 10 to 20 years. In terms of safe, I think it's relatively safe. We do this under a local anesthetic, typically, or a monitored anesthetic, so the patient is lightly sedated and will block the foot or the leg with a nerve block to control the pain. And I would say the greatest advance in the last decade has really been the internal fixation that we use. So more and more people are able to undergo a bunionectomy and put some weight on the foot, not depend on 6 or 8 weeks of complete non-weight bearing with crutches. Now, some people may need to use the crutches for a prolonged period of time, but probably the majority of bunionectomies can be done and you're either in a healing boot, like a removable cast walker, or a surgical shoe, putting some partial weight through the foot. But there's no shortcuts to healing either. It is a period of time where, bone takes at least 4 weeks to heal, and it's still healing at 8 weeks and 12 weeks. So you can't expect to have bunion surgery and then to go on a jog in 6 weeks or to put your high heels on in 6 weeks. It's a patience. It's time to heal.
You're listening to Dr. Georgeanne Botek. She practices podiatric medicine at the Orthopedic and Rheumatologic Institute of the Cleveland Clinic. She's head of podiatry and medical director of the Diabetic Foot Program.
We need to take a short break. When we come back, we'll find out about treating nail fungus.
When does it make sense to remove a toenail, and when could a home remedy be helpful?
We'll also learn about preventing and treating ingrown toenails.
What are the best ways to manage plantar fasciitis?
Dr. Botek will tell us what we should be thinking about as we're taking care of our feet.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Thanks for listening to this podcast of The People's Pharmacy. If you like it, why not rate or review it in the iTunes store? We'd appreciate it. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel utterly soft and smooth. The number is 800-345-7339. The website is uttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1070. The number again, 800-732-2334, or find it online at peoplespharmacy.com.
How are your feet holding up? Do you have to work standing up or walk a long way in the course of your day? If so, you really notice foot problems when they crop up. When your feet complain, they affect your entire well-being.
To learn more about keeping your toenails comfortable and managing the pain of plantar fasciitis, we are talking today with Dr. Georgeanne Botek, podiatrist at the Orthopedic and Rheumatologic Institute of the Cleveland Clinic. She's head of podiatry and medical director of the Diabetic Foot Program.
Now, Dr. Botek, I apologize for the next question because we do drive dermatologists and podiatrists, crazy is the truth, when it comes to nail fungus. Because it seems like a lot of people have nail fungus these days. It's ugly. It thickens the nail. It gets yellowish or brownish. It's deformed. It's ugly.
But for most people, ugly is pretty much the extent of it. It's not really going to affect walking or other function for most people.
But those television commercials make it seem like, wow, there's this great medicine, and all you have to do is apply it with a little applicator, and it'll take away your nail fungus in about 48 weeks to a year, and it'll only cost you several $100s. But, man, this is great stuff. And I'm obviously not mentioning any brand names because we don't want to get into too much trouble. But a lot of people have contacted us with, I would say, half a dozen to a dozen home remedies. And whenever I mention home remedies, the dermatologists scowl. But they only cost pennies or at most a few bucks compared to hundreds and hundreds of dollars. So I just what's your take on nail fungus?
Mm-hmm. Nail fungus is the bane of my existence. It is really something that's hard to cure. It is just very challenging. And I mean, a day doesn't go by when someone isn't bothered or asked about their nail fungus. And I think you had it right, Terry. It is more of a cosmetic problem than it is a medical problem. So I think just making people aware that this isn't going to travel to their heart or their lungs or lead to anything that's more systemically scary. And so many of those treatments are like snake oil. I mean, patients are using it and losing their toenails, and still it's not definitively cured. And then the price of the newer prescription drugs is astronomical. So it's almost like I would never tell someone that they have to do anything for their toenail fungus that's going to cost them out of pocket hundreds and hundreds of dollars and still not have a definitive cure in the majority of patients. So, I think education is key. It is more cosmetic. B, the treatments are difficult, especially topical, because let's face it, most people would rather just pop a pill or take a pill than to use a lacquer on their toenails for 12 to 18 months, file their nails once a week, and still, not be 100% satisfied. I think the key with toenail fungus is trying to catch it early, though, because if you catch it early, I think your success rate can be quite good. Once it's involving 10 of your toenails or 6 of your toenails and 100% of the toenail, really there's only one treatment that has proven good results, and that's the oral therapy. And I wouldn't discourage anyone from taking the oral therapy if they're a candidate. And not everyone is a candidate. It can interfere with some of your systemic medications and blood thinners, or maybe your blood work isn't good enough to take one of the oral medications. But that is really the best thing that's on the market. And it's cost effective, too. Let me tell you, these medications have often gone generic, and it's very affordable for someone who is a candidate to take it for 3 months.
Now, I thought you were going to say the only definitive treatment is nail removal. And I was like, wow, that's got to be painful having your nails removed. But we have heard people do that, and it still can take a while for the quote-unquote cure. And sometimes even after your nails are removed, the nail fungus comes back. That wouldn't be nice.
No, I don't remove toenails for toenail fungus unless they're painful or ingrowing, or if we're doing it maybe for one toenail permanently, where we're just not going to have that nail grow back or that corner of the nail grow back. Just to remove the toenail for the sake of the fungus and allowing it to grow back hasn't really shown a lot of evidence with good success. And you're right, it is uncomfortable, and you have to modify your lifestyle for a little while if you're going to have a toenail removed like that. So, nope, that's not what I would say. I would say maybe polish your toenail and then you don't have to look at it.
A lot of people do that too.
Well, it's easy for you to say, but I know some people with really, really ugly looking nails, and they're going, nah, I can't go out in the summertime and reveal those ugly looking feet because everybody's going to laugh at me.
I have another toenail question, if I may ask, please. Ingrown toenails.
Well, wait, before you get to ingrown toenails, what about those home remedies? I mean, there are people who tell us if you just soak your feet in amber Listerine and white vinegar for half an hour to an hour, a couple of times a week for 6 to 8 months, it works like a charm. Or then other people say Vicks Vapor Rub smeared on your feet in the morning and the evening. And then other people will tell you it's hydrogen peroxide. I mean, the list of this stuff goes on. And some people swear it works, and it's not very expensive. What do you think about home remedies?
Well, I'd say go for it. Good luck. Good luck. It's not something that I can really recommend, Joe. I mean, it's not something that I consistently see results with. And maybe it's not, that Head and Shoulder shampoo, or it's not the Vicks, but it's maybe the applier, the individual who can't stay consistent with it. We have to have it penetrate through the nail. So to go entirely through the surface of the nail and then maintain its effectiveness so that the new fungus, or there's no fungus that reproduces or continues to grow. So there is no quick fix. And if you want to talk to your friends or seek out the internet, you have to be committed to the life cycle of that nail as it grows out. So we're talking a long process. And again, it's much easier, to pop a pill than to soak your feet for 10 minutes twice a day, every day for the next 12 to 18 months. It's just hard to stick to it. But there are antifungal properties in some of those home remedies, whether it is Vicks or it is Listerine or it's white vinegar or Head and Shoulder shampoo, there are antifungal properties. So I'd say if you have a mild case and you're willing to do something consistently, you should be able to see the result within about 3 months. If you're not seeing any results in 3 months, then I would stop it. You might want to take a photograph of your toes, actually, those ugly toes. Don't let someone get a hold of your phone. But then you can really be honest with yourself and see, is it progressing? And you have to be mindful that you're not using nail polish while you're doing this too, because you can't see it and it can't penetrate through if you're putting on something topically through nail polish and then your toenail, then to the base of the nail, where it meets the skin. And that fungus is underneath that nail, so it's got to be able to penetrate.
And of course, you really do need a lot of patience. Toenails grow very slowly, and you have to wait until the nail is completely grown out.
And you also have to be filing. You have to be filing your nail, on a regular basis, taking that emery board and going over the top of the nail, keeping it thin so that the product can work to the level of the fungus. So in conjunction with that, it's kind of a 3-step process. Whatever you're using, that's your home remedy, the daily application, the filing, soaking, the whole works.
Dr. Botek, what can you tell us about ingrown toenails?
They're painful. They're very painful.
That's what I hear. And what do we do about them to prevent them or to treat them?
So in preventing ingrown toenails, it's not always that preventable, because we're seeing this often in teenagers, people who are going through, kids who are going through fast growth spurts. That's the most common population of, patients that we have with ingrown toenails. But in general, if you're putting on a pair of shoes that's uncomfortable, why are you wearing them? What else do we put on our body that's uncomfortable? So just let comfort be your guide with your shoes, not just the fashion, because those pointed-toed shoes are the ones that are rubbing on the inside corners of your big toenails. That's the culprit there. You don't want to cut down on the toenail if it's not hurting you. So try to keep that nail straight across when you're cutting your toenails. Unless it's really hurting or it's red and inflamed, then you might have to go digging a little bit or seek out, a professional. But straight across is the general rule. And if you find yourself in a situation where you cut your toenails and afterwards it's hurting, put topical antibiotic ointment on it so it doesn't get infected. Give it some time, maybe keep it cushioned with a bandage for the first few days. Again, just trying to keep it clean. Soaking your foot actually can really help with an ingrown toenail. We have a whole slew of things that we recommend in the office, but really just a soapy, sudsy water, lukewarm soak for 10 or 15 minutes can buy you some time if you're waiting to get an appointment or if you really think this is going to need to be professionally cut out. If you're suffering with ingrown toenails that's chronic, like 6 to 12 months time of just every 2 months you're doing bathroom surgery, there is a really good procedure, and that's where we remove the root of the nail. So we take out the side or just a longitudinal edge where your skin and nail meet, and take out the offending nail border and then remove, there are different techniques to remove the root of the nail so that now you have a little bit more of a narrow nail, but it's the end of your painful process the majority of the time.
Dr. Botek, we talked about flat feet. We talked about ankle injuries like sprains. I wonder if we could talk about what I suspect is another very common problem, and that is plantar fasciitis. What is it? What causes it? And what can be done about it?
So plantar fasciitis is one of the most common things that we see, and so many doctors see, whether you're a sports medicine doctor, an internal medicine doctor, orthopedist, podiatrist. Very common after the age of 40. And the plantar fascia is a normal structure. It's not muscle, it's not tendon or ligament, but it's fascia. So fascia is this inelastic cord-like structure that inserts from the heel all the way out to the ball of the foot. And there's 3 bands on the bottom of the foot. The most common fascial band that will cause heel pain is that inside band, the one that's nearest to the arch of your foot. And it's a thickening, it's a strain, it's almost like just a pulling or a tearing sensation when you first go to get up in the morning and you feel that ouch. That plantar fascia is pulling where it attaches to the heel at heel strike, right when your toes are clearing the ground to take that first step. And it's pulling and causing a painful process. So the treatments are many, but we talked a lot about foot inserts, supporting the arch. So I'll tape people's feet when I first see them to give them immediate relief. It's like a built-in arch support. So taping up the arch, a little bit hard for the individual to do, but something that we commonly do when we see patients who are suffering with plantar fasciitis. Ice, nature's anti-inflammatory, that can be really relieving if you're starting to feel sensations of plantar fasciitis. Ice your foot 2, 3, 4 times a day, 10 to 15 minutes. That will make a great difference. Don't go barefoot, because what you want to do is you want to take the tension off of the bottom of the foot where the fascia is. So by lifting that heel and arch, you're going to have pain relief. A good jogging shoe is a good resolution just by putting shoes on even in your house. If you're going around barefoot or in flip-flops, by putting that jogger on, you're going to get relief of that heel pain. The icing, the stretching your calf muscle. 80% of the time, that tight Achilles tendon is associated with plantar fasciitis. So if you stretch your Achilles tendon, you can get some good relief from your plantar fasciitis. The more severe cases of plantar fasciitis could require our help, like occasionally a cortisone injection, a custom-made foot orthotic, the heel strapping, anti-inflammatories. Your Motrin, Advil, Aleve family can give you some good relief. So maybe a short-term course of that is indicated. And then there's also, more invasive procedures that are done. But that's really the minority of cases in those who have gone on for a year or more of having plantar fasciitis that would move on to a surgical result.
Dr. Georgeanne Botek, what are the most important things we should think about as we're taking care of our feet?
Foot pain isn't normal, so don't accept it as being like, my feet ache, I'm sore, I need to lose weight. It's not normal to have foot pain, no matter what your walk in life is. So as time goes on and if weeks go by and you're still having unremitting foot pain, seek out a professional. We can do things that can help you, whether it's just self-help that you need or a definitive type treatment or something that can actually be done to your foot. Swelling, if your foot has swelling, you don't want to continue to walk on it. If you're limping, you don't want to continue to walk on it. That's a problem that might require, professional attention. And, your feet, you only get one set in a lifetime, so take care of them. Whether it's a skin problem or an ankle sprain or a bunion deformity, there are some simple things that can be done to help accommodate your foot, give you a pain-free foot, or other treatments that can help in the long run. Shoes and inserts do matter. Your shoes can be your treatment, and sometimes it takes a little bit of direction as to what kind or style that can help your specific foot problem. But take care of your feet. It's not normal to have pain, and live on.
Dr. Georgeanne Botek, thank you so much for talking with us on the People's Pharmacy today.
Thank you.
You've been listening to Dr. Georgeanne Botek. She's a doctor of podiatric medicine at the Orthopedic and Rheumatologic Institute at the Cleveland Clinic. Dr. Botek is head of podiatry and medical director of the Diabetic Foot Program.
Shoes are so important, and it really makes sense to get shoes that feel good.
And you can't really tell how those shoes are going to feel by just walking up and down the aisle at the shoe store. I mean, you get home, you start wearing them, and then you go, oh, ouch, my toes hurt. These shoes, they looked good. They seemed to feel okay, but now, not so much.
Well, there are some shoe stores now that will let you take the shoes home, wear them in the house. You can't wear them outside. Wear them in the house, and if you discover after a week or so of wearing them that they don't feel as great as you thought they would, you can take them back. You have to ask ahead of time.
Absolutely. Dr. Botek wasn't too thrilled with our home remedy idea, but if you are persistent with home remedies, whether it's cornmeal mush or the Listerine vinegar soaks or the hydrogen peroxide or the Vicks Vapor Rub or the iodine topical treatment or the tea tree oil, there are a lot of people who say, they work.
Right, and the same one does not necessarily work for everyone.
That's true. We'd love to hear from you, by the way. Have any of those home remedies worked for your nail fungus? Send us a message on peoplespharmacy.com.
Lynn Siegel produced today's show. Al Wodarski is our engineer. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman, and he has his debut album out. Look for it, Natural Public Liederman.
The People's Pharmacy is made possible by Radix Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. The number's 800-345-7339, online at uttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1070. That number again, 800-732-2334, or place your order online at peoplespharmacy.com.
And when you visit our site, you can check out information on drugs, herbal medicines, home remedies, share your thoughts on today's show. We'd love to have your feedback.
You could sign up for our free online newsletter or the free podcast of the show. Listen at your own convenience. It's all there at peoplespharmacy.com.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.